One point that really needs to be emphasized is that it's not medication or surgery, it's both. If you need care for obesity, it's not one or the other. Like, they both help differently. You might be ready for one, not ready for the other, but don't buy into the hate. Don't become so, keep your mind open. How about that? Just open mind, because it would be great if the medical world actually knew what the best treatment for you is or would be, but we don't. And so any obesity doctor who tells you this is what you should do, just take that with a grain of salt. It's really a suggestion. You have to want to do it. You need to buy in, and really it's about you. It's called patient-centric care. I'm a surgeon, I could easily tell everybody that surgery is what they should do, but that would be misinformation because some people aren't ready for it. And most of these interventions work better when you, as the patient, have bought in and decided that it's right for you. And the reality is that we don't even know what the best treatment for you is going to be, and we have no way to predict it. We don't have a test that can say, all you need is meds and you'll be fine. We have no idea. And the other sort of almost sad thing about it is that different interventions work differently in different people. So even if your best friend got Ozempic and lost a bunch of weight, that doesn't mean that's going to happen for you. In fact, all the studies that have been done to get approval for drugs or for surgery or any of that stuff shows that there are a certain number of patients who will not respond to that intervention, no matter what that intervention is. So some of it is just taking a best guess and moving forward, making that commitment to do something to change for the better. And then if it doesn't, just know that there are other options. Keep it on. Hope, fighting spirit, all those things are super important. There are certain patients who get medications and they don't lose a lot of weight. And then they get surgery and they do. And then there are other patients who get medications and lose a lot of weight and then don't need surgery. But then they stop their medication and then the weight comes back and then they get surgery. And then some people get medications, then get surgery, and still need more medication on top of that. There are even what we call revisional surgeries, where you have one surgery but then need another more aggressive surgery because the medications or the surgery together didn't do enough. So it's really just none of it is patient failure. We talk about failure, which is a terrible word to use when we're treating a disease. It's really that they just haven't achieved what we were hoping. And again, it's not your fault. No matter what any provider tells you, if you don't respond to an intervention, it's not because you're cheating or you're not following the guidelines or the recommendations. It's not you. It's you, but it's not your choices. It might be your genes, it might be your epigenetics, it might be something else, but it's not you sabotaging your own success. What sense would that make? I don't even know why we talk about that in the medical world. Who wants to have surgery and then have it not work? Why would you purposefully do that to yourself? It's crazy. So the problem is that none of us have really, me included, although I do have one publication on this topic, but none of us have really studied what a best practice could look like in terms of medications and surgery, or whether failure to respond to one intervention even predicts a failure to respond to another intervention. So there's all this stuff that needs to be explored, and we really haven't done it yet. So we use the average results of anything to try to guide us, but we know that the average patient isn't everybody. So once we decide upon an intervention, there's some of those hurdles we talked about before in terms of the insurance, and we'll talk about in the next episode, which is how do you navigate the system, the healthcare system. It's crazy complex, shouldn't be that way, but it is. Not necessarily even designed to help the patients. And there are hurdles that you just gotta know about and try to overcome. But, watch the next video if you want to learn about that. Again, if you like what you're hearing, share it, post comments, feedback, super helpful for me. And maybe the most important thing, because I say it every time, is that obesity is a disease, not a lifestyle choice, and you can do something about it no matter where you are in your journey. So I hope to see you the next time.